friends, I'm Dr. Urvashi, MD Internal Medicine. So today I'm going to share with you regarding iron deficiency anemia, which is the commonest anemia worldwide. So what are the major causes of iron deficiency anemia? Iron deficiency anemia has three main causes. One is inadequate dietary intake. If our diet is insufficient in iron, then we may land up with iron deficiency anemia. This is commonly seen amongst vegetarians until unless they supplement their diet with iron supplements. Second is impaired iron absorption from the gut. That might be because of some diseases like inflammatory bowel disease, celiac disease, or gluten sensitivity as known to laymen. Third important cause is blood losses from the gastrointestinal tract, which might be because of underlying piles or hemorrhoids, again inflammatory bowel disease, and in females of reproductive age group, if they have excessive bleeding during menses, they may develop iron deficiency anemia. So next, see what are the symptoms, what are the common symptoms you can easily see and recognize that you are suffering from iron deficiency anemia. One is easy fatigability, that even with mild activity you feel fatigued, you feel tired. So you might be suffering from iron deficiency anemia. Second is leg cramps. While climbing stairs, you develop leg cramps. Third is craving for ice to chew or to suck. Fourth is cold intolerance. And next is poor attention and memory. If you are feeling that you lack attention, your memory is deteriorating, you might be suffering from iron deficiency anemia. Next is reduced resistance to infection. You are prone to infection if you have underlying iron deficiency anemia. Dysphagia to solids, that might be because of esophageal webbing, which may be associated with iron deficiency anemia. And worsening symptoms of underlying chronic lung or heart disease. A patient who was suffering from chronic lung or heart disease for so many years, if there is sudden worsening, that might be because of underlying iron deficiency anemia. So now let's see how to treat iron deficiency anemia. To treat, we need to treat the underlying cause. So we need to order a set of investigation which your concerned doctor will order, and then they will confirm the diagnosis. So treat the underlying cause, and next is to supplement your diet with iron-rich food. So today I am going to tell you about 7-8 common foods which are highly rich in iron. So one is pumpkin seeds. 1 ounce of pumpkin seed contains around 2.5 milligram of iron, which is around 14% of our daily iron intake. So what is our daily iron requirement? In females, this is approximately 18 milligram, and in males 8 milligram. And second is lentils. 1 cup of cooked lentils contains 6.6 milligram of iron, which fulfills around 37% of our daily iron requirement. Third is tofu. Tofu is not just a protein-rich diet, this is also rich in iron, and 1 cup of cooked tofu contains around 3.4 milligram of iron, which fulfills 19% of our daily iron intake. Next in our list is spinach. 1 cup of cooked spinach contains around 6 milligram of iron, again which is a very high proportion. Approximately 33% of our daily iron requirement gets fulfilled if you consume just 1 cup of cooked spinach. And remember, all green leafy vegetables are rich source of iron. Greener the vegetable, more is the iron content. Next in the list is chickpeas. 1 cup of cooked chickpeas contains around 6.6 milligram of iron, which is 37% of our daily iron intake. Next, that is on the 6th number in our list, is quinoa. 1 cup of quinoa contains 2.8 milligram of iron, which is 16% of our daily need. So if you consume quinoa contains all 9 essential amino acids. So that's a very good source of protein, as well as good source of iron. So high protein and fiber intake will make you fuller for longer time, and that will help in weight loss as well. Next in our list is dark chocolate. A piece of 1 ounce of dark chocolate contains 3.3 milligram of iron, which is approximately 19% of our daily requirement. So dark chocolate is also a very rich source of iron, but beware of the sugar content. So try to consume dark chocolate with minimal sugar. So next in our list is fortified cereals. So fortified cereals are so much fortified with iron that even one serving contains 18 milligram of iron, that is 100% of our daily requirement. So if you consume fortified cereals, almost lot of your iron requirement is fulfilled. But you need to just take one thing into account, that it should contain minimum preservative, as minimum as possible, and sugar content should also be low. So these were the iron rich foods. So let's come to the next point. Next point is that iron supplements. So one need to take into account which iron supplements we need to consume, which one is better for us. Market is flooded with lots of iron supplements, but most commonly and most economically used iron supplement is ferrous sulfate, because this is very cheap, this is easily available, but yeah, it has some issues, like it may cause gastritis, it may cause constipation, but still majority of the people take iron in iron sulfate form. So if you are intolerant to iron sulfate, you can consume another salt, which is iron bisglycinate. This salt has better bioavailability, it has lesser side effects, and it has better absorption in the gut. So when you consume any iron salt, just take into account you should avoid tea and coffee for 2 to 3 hours before and 2 to 3 hours after your iron intake, so that the iron gets better absorbed. And now let's come to the next point, which is another very important point, and most of the people miss that point, that how frequently we should consume our iron tablets, whether we should take iron tablets daily or whether we should take iron tablets alternate day. So what recent research says? Recent research says that alternate day therapy is better than daily dosing, because when you take iron daily, there is a hormone which is released in our body. It is known as hepcidin, that reduces iron absorption from the gut, and that this thing remains for another 24 hours. So if you consume iron daily, hepcidin level in the blood remains high, so subsequently less and less iron is absorbed from your gut. So if you take iron alternate day, so second day the hepcidin level falls. So once hepcidin level falls, iron absorption from the gut is augmented. So even with lesser dosing, more and more iron is getting absorbed. So it's best to take iron alternate day, so that you have better absorption